Good afternoon. My name is Carrie Goki-Mori, and I'm student body president here at Stone Ridge. Thank you so much for taking time out of your busy schedules to join us. As of October 17, 2019, the Centers for Disease Control and Prevention reported a total of 1,479 lung injury cases and 33 deaths associated with vaping. According to 2018 National Youth Tobacco Survey data, current e-cigarette use, or vaping, among middle and high school students increased alarmingly between 2017 and 2018, with over 3.6 million kids currently using e-cigarettes in 2018. From 2017 to 2018, current e-cigarette use defined by use on at least one day in the past 30 days by high school students increased 78%, from 11.7 to 20.8%, accounting for a troubling 3.05 million American high school students using e-cigarettes in 2018. This is why Stone Ridge is honored today to partner with Suburban Hospital, Johns Hopkins Kimmel Cancer Center, the American Lung Association, and Montgomery County Cancer Crusade to present this panel for a conversation about the dangerous realities of smoking and vaping and the threats posed to our students and communities at large. We're delighted to welcome 4 experts in their fields to share their insights with us today. Dr. Stephen Roderick is Assistant Professor of Surgery at Johns Hopkins University School of Medicine and thoracic surgeon, specializing in lung cancer treatment at Johns Hopkins Kimmel Cancer Center. Dr. Philip Corcoran is a cardiothoracic surgeon at Johns Hopkins Community Physicians Cardiothoracic Surgery at Suburban Hospital, who has served as an expert on clinical manifestations of vaping, particularly popcorn lung. Nicole Goldsboro is the National Manager of Lung Health Education at the American Lung Association. Our moderator, Dr. Panagis Galiotsatos, is Associate Professor, Division of Pulmonary and Critical Care Medicine at Johns Hopkins University School of Medicine and Director of the Tobacco Treatment Clinic at Johns Hopkins, where he sees patients exclusively for addiction to combustible cigarettes or e-cigarettes. Please join me now in welcoming our esteemed guests.
So thank you so much. And by the way, great pronunciation with my name. That's fantastic. I think that's the first person who gets credit for that. So excellent. So thank you all for having us today. I'm your moderator, Panagis Galiotsatos. Many of my patients call me Dr. G, so if that's how you would like to approach me as well, that's perfectly fine. So I have the great privilege of moderating this event for you all this afternoon. And so with that said, we have 3 key experts, 3 key people coming at this conversation through very unique vantage points, clinically, scientifically, as well as from an education. So what we'll do is kick things off with Nicole first from the American Lung Association.
Sounds good. Hi everyone, thank you so much for having me here. Like I said in the introductions, my name is Nicole Goldsboro and I'm the National Manager from the American Lung Association. And so I really wanted to kind of get started today and give you kind of a snapshot of what's happening both in the state of Maryland as well as nationally, and take a look at some of the tobacco-related percentages. So the average smoking rate in the state of Maryland is about 12%, and nationally we're looking at closer to 14%. The high school smoking rate in the state of Maryland is about 8.2%, whereas nationally it's a little bit lower at 5.8%. But what I really wanted to kind of direct your attention is the 13.3% are high school students who currently use e-cigarettes. And as kind of said in the beginning, the national rate and kind of where we're drawing all of this attention is nationally, it's a 27.5% e-cigarette rate. So it's definitely on the verge of a vaping-related epidemic. So the next slide. As I said, the Surgeon General and the FDA are calling this a youth epidemic. And like it was mentioned, there has been a 78% increase in use over high school students and a 48% increase in middle school use. within the 2017-2018. And then in 2019, we're seeing a 27.5% increase, which is a 32% increase over the past year. So why is this such a concern for youth? And the one thing is, it's predominantly used by youth. If you take a look at the information on the slide, this is definitely something that is directly marketed towards youth, and there's several reasons why. And one of the biggest reasons, which we'll get to, is the fact that it is these are flavored products, and we know that youth use flavor products more than adults. Another thing is when you take a look at the adult use of e-cigarettes, it's at 2.8%. So there is definitely a difference between those adults who use e-cigarettes as well as the youth. So one of the biggest questions we receive at the American Lung Association is, do e-cigarettes help people quit smoking? And the fact that you're switching from a tobacco product such as cigarettes and going to an e-cigarette, you're really not quitting. We encourage, quitting means ending your addiction to nicotine. Often, and most often, e-cigarettes do contain nicotine, even the ones that say they do not. And although quitting smoking is difficult, it can be done, and that's really one of the most important messages, that it is possible to quit smoking. So the fact that most e-cigarettes do contain nicotine, it really only helps sustain the addiction to nicotine. And we found that more than half of the adult e-smoker individuals who use e-cigarettes still continue to use traditional cigarettes. And then only 10% of people who smoke and switch to e-cigarettes actually do quit, where about 26.6% of people who smoke and use one of the FDA-approved methods, such as quit smoking counseling, as well as the patch, they do have a better success rate. And clearly, e-cigarettes, as the FDA said, they are not quit smoking products.
Perfect. Thank you so much, Nicole, for that great insight, and especially with the statistics that you've shown. And sometimes those numbers can tell a story better than words can, even though we'll hear some personal narratives of patient cases from our two surgeons here. Nicole, the one thing that strikes me that's very concerning is all those patients who are using, all the community members who are using electronic cigarettes. Like the electronic cigarette produced in the Chinese market by Dr. Han Lick, a pharmacist there, 2003, entered the American capitalistic market around 2007. This is a new product, right? We don't know much about it. And our fear, my fear as a physician, I imagine everyone else's fear here, is if we don't get around this fast and quickly to minimize this epidemic, right, we're going to create a new cohort of patients moving forward, right? Everyone who is smoking electronic cigarettes without knowing the ramifications of long-term consequences, and we don't, right? This is a new product. So one of your student-submitted questions was, what's the long-term outcomes of vaping? We don't know, right? We haven't been there. This is a 12-year-old product here in the States. But with that said, it reminds me of how medicine was unable to keep traditional smokers back in the 1950s from recognizing the ramifications of smoking, and then we created a new cohort of patients with COPD, emphysema, lung cancer. All that said and done, right? And I know this might get a little bit into your conversation later about the education that American Lung Association is doing, but recognizing where we're at, seeing how many youth are smoking, this epidemic, from an educational standpoint, what would you encourage the community to begin to do?
As far as, and it does go into a little bit of kind of the conversation that I'll have as a follow-up, one of the things is really become more informed about what the current what's going on out there with e-cigarettes. The truth is, with e-cigarettes, and that's kind of, there's more of an umbrella term called electronic and nicotine device systems, which is really kind of the catch-all for the different products out there. E-cigarettes is only one of those products. And so as you're looking to become more educated, recognize that there's other products out there, like USB drives that look very similar to USB drives, but they're actually a type of e-vaping product, or e-pens that look like a traditional pen. So the truth is that you really want to become more aware of the different products that are out there, and then some of the short-term health effects that can arise when using it, which some other panelists will discuss. There's things as far as advocacy that you can do. One of the biggest pushes at the American Lung Association, besides Tobacco 21, which is already in effect in the state of Maryland, is to ban and remove all flavors, including mint and menthol, when it comes to all tobacco products. And that includes cigarettes, cigars, cigarillos, because we know that once those flavors are banned in one product, people will jump to another product to purchase it. So those are really, from an advocacy standpoint, as well as kind of the biggest messages is just become aware, get more involved in the advocacy perspective, and just help educate and encourage others if they're using to quit. Yeah.
No, that's incredibly well said, and that's great actionable items that the community can take, right? First, recognize what we're up against, right? I being at Stone Ridge today, I think the David and Goliath story is one of the things that is a good analogy, where we have to recognize who Goliath is, right, in order to arm ourselves of how to combat. And Goliath is our electronic cigarette epidemic that we're facing. So what you said is great for the community members to recognize, well, what do the devices look like? You'd be surprised how many parents have reached out to myself and my colleagues to say it was right under our noses the entire time and we didn't pick up on it. And then the symptoms, right? If you have youth, right, or adults that always seemed pretty okay in health, but all of a sudden they have a cough they can't kick, they have a wheeze that's suddenly new, recognize these changing symptoms may not be simply just asthma, just due from environmental causes. It may be due from electronic cigarette use. So I encourage you all to be on the lookout to help us. And then the last part that you brought up, and I know you'll discuss it a little bit more wholeheartedly, is make sure that the resources are given to people who do use electronic cigarettes. I always encourage people to be pro-smoker but anti-smoking, right? Non-judgmental way in order to make sure that your loved ones, your community members, go forward and find the resources they need to help quit this addiction. Very well said, Nicole, and I appreciate it, and we'll turn back to you at the end for more that we can do. So with that said, now I'm going to turn my attention to Dr. Stephen Roderick, mainly because it's alphabetical order and the B's. But you know what? Since we'll be a little atraditional, let's go with Dr. Philip Corcoran. Is that okay? Because he's sitting right next to me. It's just easier to go to him. That's great. So Dr. Philip Corcoran, already introduced earlier, a surgeon, cardiothoracic surgeon, and cardiothoracic and vascular surgeon at the Johns Hopkins Medicine Suburban Hospital. Dr. Corcoran, who also has a daughter in the audience, I believe, as well. And I may have planted the most difficult question for her to ask her father, so we'll see if she follows through with that. But Dr. Corcoran, go ahead.
Thank you very much for that kind introduction. Thank you very much for that kind introduction, Dr. G. As was mentioned, I'm practicing, as is Dr. Roderick and Dr. G, practicing physician, caring for patients with lung concerns and lung problems every single day. And this, the use of the electronic cigarettes has come onto the scene incredibly rapidly. And we see a number of different patients, particularly young patients, who have lung problems. One of the most common lung problems that we would see is during earlier or mid-adolescence rapid growth with the development of blisters at the very top of the lung, the leading edge of growth of the lung. That's called primary spontaneous pneumothorax with bleb disease, and that's a common operation to go ahead and remove these blebs. We know that conventional cigarette smoking, inhaling combusted, burning tobacco products is a risk factor for that, and we ask every single one of our patients. Over the last several months or so, all the patients say, no, I'm not doing any smoking, but I'm vaping. So we're seeing an awful lot of patients that are coming into our office who are inveterate vapors, every single day vapors. Most recently, I have a patient. I won't be able to show you any of the photographs of this particular patient because mom and dad said absolutely not. So I apologize for that. But Dr. Roderick will be showing us very, very similar photographs and pathology of what happens to the human lung when we use these type of products. This is a healthy, physically fit, active, athletic young gentleman who comes to my office with, as Dr. G mentioned, chronic cough, a problem, and a lung that had collapsed. So we ended up doing surgery on one side, and what we took out, instead of being normal blistering at the very top of the lung, with a lung that had literally lost its blood supply. So the medical term for that is necrotic lung. And our pathologists are looking at this because he's recently operated on, and he'll need an operation on the other side in about 4 weeks. And we simply are very worried that his multiple times per day use of these products has contributed to this very unusual finding of his lung, where an otherwise healthy individual who's really physically fit has lost the blood supply to portions of his lung. So we're very, very concerned about this. We'd like to allow Dr. Roderick to go ahead and show some of his slides, and then we'll continue our interactive discussion.
Thanks. Can everyone hear me okay? This portable should work. So I want to talk about the clinical manifestations of vaping, and I would echo what Dr. G said and stole my thunder a little bit, but I think the number one message that we have is we don't even know what we don't know yet about vaping, its effects on the lungs. We're only talking about lungs today, but who knows what else it does to the human body, right? We know that smoking has effects on your peripheral arterial system, your heart. Vaping, probably the same thing. You're inhaling a lot of the same chemical compounds when you vape as when you smoke. I also want to thank Nicole and the American Lung Association for the work that they do day in, day out in advocacy for our patients and trying to protect us. They are up against Goliath, which is the tobacco lobby. Juul is actually now owned by the same parent company that owns Philip Morris, that makes the majority of the cigarettes that are smoked in the United States. So we are up against Goliath. These companies are not trying to help people stop smoking. They're not trying to have a safer alternative smoking for young people like yourselves. They're trying to get you addicted to nicotine so that you will buy their product for the rest of your life. Smoking-related lung disease. Anybody think smoking is a good idea? Anybody think smoking is healthy? No, of course not. It's almost 2020, right? We've known that for decades. But these are the smoking-related lung disease that we deal with, Dr. Corcoran and I, every day. This is lung cancer. This is an actual patient of mine. I apologize that there's four images here. I pulled these from a paper that we recently published. But this is a large mass in the upper lobe of the right lung. It's invading the mediastinum, which is all the structures in the center of the chest. It had actually grown from one imaging study to another despite systemic therapy with chemotherapy, and it had spread to some of the lymph nodes in the center of the chest. Unfortunately, this person has a pretty poor prognosis. The median survival of this scenario is under 2 years. So half the people that present like this are not alive any longer 2 years later. This is emphysema, and I'll show you a normal CAT scan of the lung. Is there any way we can dim those lights a little bit and see the resolution of these better? Is that possible? I don't mind standing in the dark. That's okay. There you go. Perfect. So if you look at these lungs, this is actually not terrible on this side, but over here you see all this black area. This is just space. It's air. All the air outside of the person's body is just empty black space as well. And what happens with emphysema is all the little air sacs, the alveoli in the lung, coalesce. And so you go from having hundreds of thousands of microscopic alveoli to these big conglomerations of air sacs. Oh no, lost my thunder there. And that's what emphysema looks like. And the problem with this is that you trap air. So it's not that you can't get air in, but people with emphysema can't get air out. And we all know that emphysema is the result of long-term smoking. Smoking became common in the U.S. sort of post-World War I. That's when American males really took up the smoking habit. Women trailed by about a decade or so, which is why we see in the lung cancer curves that the diagnoses in men are actually going down, and the lung cancer diagnoses in women, the tail of that curve is not as low as it is in men because the smoking epidemic in women was actually kept under wraps for a while. It wasn't common public knowledge that women were smoking as much as men in the 20s and 30s, and so we're still seeing the tail of that. By the 40s, smoking was cool, right? Everyone was doing it. These are some actual ads. This ad over here, more doctors smoke Camels than any other cigarette, was published in the Journal of the American Medical Association. Our own journal was publishing these ads. 20,679 physicians say Luckies are less irritated. Smoke fresh cigarettes. What does that sound like right now? Who's promoting a fresh cigarette for people right now? And then in the 50s, we had the Marlboro Man, right? This is an iconic ad, and I would submit to you that the e-cigarette companies, the vaping companies, are now starting to give us new Marlboro men, right? It's 2019, right? Everything's going to be smooth and sexy. You're going to have this fancy apartment overlooking Lower Manhattan. There's the Empire State Building. You're hanging out in your bathrobe, looking really suave, smoking your e-cigarette because it's cool, right? They're not trying to tell you that this guy is quitting smoking, right? They're trying to sell you e-cigarettes. It wasn't until 1954, my mentor was actually the Evarts Graham professor of thoracic surgery at WashU in St. Louis. But Dr. Graham was a thoracic surgeon, a chest surgeon, and he made this smoking machine. And all these are cigarettes that are being combusted, and the smoke was collected, and there were a bunch of small animals, unfortunate little guys, that were breathing in this smoke, and they all developed lung cancer. And it wasn't until a few years later that Dr. Graham and Dr. Winder, who was a medical student at the time, published the first paper saying that tobacco smoking is a possible etiologic factor in bronchogenic carcinoma. Bronchogenic carcinoma is lung cancer. And so 1954, the smoking epidemic really took off in the 20s, so 30 years later. And it wasn't until another decade, 1964, that the Surgeon General said anything. So the first report from the Surgeon General's report on smoking and health by Luther Terry, who was the Surgeon General at the time, was 1964. These are normal lungs. These are gorgeous. We love to see these. Dr. Corcoran and I would be thrilled to operate on somebody who had these if they had a reason for us to, but most of them don't. But see how sort of nice and spongy these lungs look? Right? They are filled primarily with air. I just told you that everything outside of the body where the air is looks black. So almost all of this is air, and this is gorgeous anatomy. This is the main trachea, comes down here, and it splits into the right bronchus and the left bronchus, and then those kind of divide more into the lobar bronchi. But these are beautiful, gorgeous, nice lungs. These next images come from a recent publication in the New England Journal of Medicine. These are vaping-associated lung injury lungs. This person is a 17-year-old male, and he did survive, but will never be the same. What you see here are the air spaces are filled with all of this other material, and a lot of this is innate to the human body. It's our own body's response to injury. It's mucus, it's secretions, it's inflammatory cells that are accumulating in all those little air sacs that I showed you. And this is what that looks like microscopically. This is normal human lung, right? It's all air. And what you have are some blood vessels that come in there. This red here, these are red blood cells coming through here. That divides into these little capillaries, and oxygen and carbon dioxide are exchanged across these tiny little thin membranes in your lung. You guys are learning this in biology and physiology and stuff like that, right? You know all this stuff already? Good. This is what we see in vaping-associated lung injury. And so there's a couple of different slides here because it looks a little bit different in different people depending on their own body's response. But this is what's called organizing pneumonia. So now these air sacs, they're inflamed. See the difference in the thickness between the normal, which is really only 1 or 2 cells thick, and now you have all this inflammation and inflammatory cells in the lining of those air sacs. And oftentimes the air sacs are being plugged up with all of this inflammation, which is essentially mucus and inflammatory material. This is another sort of image of that same thing with clogged up alveoli with inflammatory material. Here, what they're highlighting for you here, see this pink stuff here? This is scar. It's something called hyaline. That's never going to go away. That's your body's response to injury, just like when you cut yourself or have some sort of injury, you develop scar, and that scar never goes away. This is scar in the alveolar sacs of the lung, and that will be there forever. Even if all this other inflammation and everything goes away, this lung is never going to be the same. And here, this is actually areas of the lung where the inner lining of those alveoli is dying, and it's sloughing off, and now you see diffuse alveolar damage with some of those membranes actually loose within the air sacs. And so that will eventually lead to these other findings, but that will also never recover. So that's what we're seeing histologically. Dr. Corcoran will tell you about some of the patients and things that he's taken care of, but my message for you really is that we don't know how bad this is yet, and I think that it is the same as what happened with smoking. 50 years ago, where now everyone knows, but decades from now we'll be saying the same thing about vaping.
Thank you very much, Dr. Roderick, for that phenomenal overview. Just wanted to, as Dr. Roderick mentioned, we know about 6+ decades of really stringent scientific research on the effects of smoking conventional combusted inhaled tobacco products. We don't really have 6 minutes worth of research, basic science research in this arena. As was mentioned, the FDA or the CDCP website is updated Thursday morning, every morning at 6 in the morning with a conference call. So we'll hear the latest statistics tomorrow, but this week's statistics tell us that there actually have been 42 deaths and 2,174 cases of this entity called EVALI, E-V-A-L-I, which is the e-cigarette and vaping-associated acute lung injury. We in medicine who care for folks in the critical care arena are familiar with the term TRALI, which is transfusion-associated acute lung injury, and the CDC has come up with this new term, which describes exactly what is being seen, which is an acute form of a lung injury. The duration of it is unclear. What is also being seen is that of these individuals who really have become critically ill with this, many of them, actually the ones who survive, go home and then they get readmitted to the hospital into the ICU with the same types of symptoms. It's unclear in my discussions with colleagues around the country whether this is simply the fact that they have not successfully, durably stopped vaping, or whether this is an injury that can sort of recur or has kind of a durability to it again and again and again. We simply don't know. With regard to research and the use of tobacco products, it's been identified, well identified, that over 7,000 different chemicals, entities, molecular products, and microparticulate elements are associated with smoking cigarettes. It's unclear as to whether that is true or not with the vaping. We now know, as we'll hear about, that Dr. G has actually submitted one of the first cases of, and he'll be talking about that in a little bit, about a secondhand or passive lung injury associated with vaping. But as we simply don't know what the mechanical nature of it is. We know that there are several products that are inhaled, including acrolein, formaldehyde, and acetaldehydes that come in with the vape. There's also concern that the way vaping works is it's a battery-operated, superheated metallic coil that then vaporizes, thermally combusts and vaporizes, usually an oil-based element. Of the 29 cases that have been studied by the CDCP, all 29 of them have this vitamin E acetate element in the products that have been taken out, either the surgical specimens that have been taken out or the washings of the bronchial areas. So we're simply not sure what is the injurious element or not, but it's clear that this is not a safe undertaking for any of us, certainly not for our kids. And with those comments, we'd like to turn it back over to Dr. G.
No, this is fantastic. Stephen and Philip, thank you both, Dr. Roderick, Dr. Corcoran, and the fact that you dimmed down the lights. Any radiologists in the room probably got really excited. They felt at home with that. So a couple things that I want to kind of start back from the beginning, because we hear the dangers of electronic cigarettes. Then we also heard the targeting of the youth. Even though the intentions, quote-unquote intentions, of the tobacco industry were these should be safer products than combustible cigarettes, right? They really try to hit home what's called a relative risk argument, meaning they're going to compare electronic cigarettes to traditional combustible cigarettes. Then how in the world does that fit in for the youth who, as Nicole was showing us, haven't picked up traditional cigarettes in quite some time, right? That number is pretty low. So the one thing I want you to focus on is it is not unintentional that the tobacco industries are targeting youth through flavored e-cigarettes or devices that look like jump drives and so forth. It is very intentional. And a lot of this has to do with the nicotine molecule itself. Nicotine, we talked about maybe biology and physiology. Let's go a little bit into neuroanatomy. Nicotine, the molecular structure, parallels that of acetylcholine, the most abundant neurotransmitter you have in your brain. And where it works, acetylcholine receptors, right, tend to be in the prefrontal cortex and mesolimbic area. And I'm not here to try to fancy you with neuroanatomical words. But the prefrontal cortex and the mesolimbic area of your brains are the parts of the brains that drive survival instincts. Have you guys heard of Pavlov's dog yet? The dog salivates when he hears a bell ringing. Right, that's your mesolimbic area driving conditional changes called arborization to take certain encounters from the environment and cue them in for survival purposes like feeding and eating. That's what nicotine does, right? It hijacks those receptors and gets people to recognize they should be smoking and when they should be smoking and why they should be smoking constantly. And guess at what age your prefrontal cortex starts to stop evolving? The age of 25. So they know that if they can get you to smoke young and expose yourself to a rather abundant amount of nicotine at a young age, the rewiring that happens in your brain around it is permanent, right? And why that's important is because now suddenly they have you for life. And as one of my patients in my tobacco treatment clinic said so elegantly to me, quitting smoking is easy. I've done it thousands of times, right? It shows you the gravity of nicotine addiction and the relapses patients face every time. The first year relapse after someone quits smoking is about 90%. They want you as their customers for life, regardless of the health ramifications that you're about to experience, right? So keep that in mind. The relative risk comparison of safety does not apply to you all, to the youth out here, right? That absolute risk, we don't know. We don't have the science, we have 6 minutes worth of it. I love that comparison, Dr. Corcoran. With that said, a couple of comments submitted by the students have already been answered. How bad can vaping hurt you? Dr. Corcoran, your description of the blebs and necrotic tissue and the lung collapse were fantastic. One thing I think we undersell sometimes in medicine is the gravity of the severity, and using words necrosis sounds bad, but one person submitted, can you die from vaping? Can you let them know the diseases you saw in the lungs, can that lead to death if it was untreated?
There's no question that it can. When we talk about this issue, the medical term, as was mentioned, is necrosis. Literally, the loss of blood supply to portions of the lung can potentially be, as Dr. Roderick suggested, an irreversible, permanent, forever-style consequence of using these types of products. That is just, and we simply don't know because we don't have the long-term experience with it. We now know that there have been 42 deaths. And the deaths have ranged in age. The median age of the people who have died from vaping, the E-Valley, the e-cigarette and vaping-associated acute lung injury, is 52 years old. But they range from age 17 to age 75. And it seems like that the ones who have died have tended to be older because they're not as healthy as the younger folks who have survived. We now know that the ones who have gotten this very serious injury, 14% of them are under the age of 18. 40% of them are between ages 18 and 24, 25% of them are between ages 25 and 34, and 21% over the age of 35. But most of the deaths, the average age is 52 years of age. And we've heard all about it. I mean, last week was the first case of a double lung transplant done in a young individual in his late teens for vaping injury, the EVALI, the e-cigarette and vaping-associated acute lung injury. And what was found at the time of that operation was, again, diffuse necrosis, loss of blood supply to the actual tissue of the lung, which there are very, very few things in medicine that will cause that. Sometimes a blood clot can cause that, but it's really perplexing to many of us who treat these patients as to how this seemingly sort of relatively safe activity can lead to such very, very serious injury. So we're all concerned that we simply do not know what the long-term effects are.
Thank you, Dr. Corcoran. And that kind of emphasizes the message we had earlier on, that while we don't know, we don't want to find out through firsthand experience through you all. We'd rather remain in a mystery if we can curb that epidemic right now. And that's why Dr. Corcoran and Dr. Roderick are here. Just to close out, and then I'm going to turn it over back to Nicole from the American Lung Association for her last portion around what we can do even more as a community. But you've heard so much concern out of us. Someone submitted, can vaping cause cancer? And actually, Dr. Roderick really elegantly showed the Dr. Widner study out of 1954. But if you paid attention to Dr. Roderick, his comments was, smoking really picked up after World War I, right? So your history lessons, look at this. We're talking about science and history, we're bringing everything together, right, on this stage. This is fantastic. But the gap between World War I to 1954 was huge, right? That's over 2 decades worth. of people smoking and actively smoking. And what we needed to figure out was more epidemiological studies that helped us really identify it does cause cancer. The challenge with that is you're recognizing some of the limitations we have as scientists and as physicians, where sometimes if we can't prove it in the lab, we're really relying on prospective and or retrospective data through epidemiology and statistics to give us that answer. But that also meant that millions of Americans became patients and lost their lives, while, with the limitations of science, that had to occur before we can tell them, no, that's not the right answer. And I see this because we have to exercise caution. Just because it may, at this moment, we don't know if it can cause cancer. You heard from Dr. Roderick, Dr. Corcoran, it can cause very lethal diseases and pathology that really should heighten our concerns, and we need to begin to combat that message that tobacco uses as safety. There is nothing safe of e-cigarette smoke going into your lungs. Unless you're breathing in just air, that's the only safe thing that lungs are designed for. So with that said, Nicole, back to you.
Thank you. And just to kind of close my portion of the presentation, I just want to talk about some of the resources and support that's available for both youth and as well as adults who are not only looking to quit smoking, but looking to end their addiction to e-cigarettes. So we'll start by some of the handouts that you have both on the chair and that are also in the back of the room. The American Lung Association has a vision to end lung disease, and part of our vision, really one of the biggest passions and movements that we have is to provide resources on a national and community-based level to support those who are looking to learn more about lung health and lung disease. And so we do have several e-cigarette resources that are available both for parents, teens, as well as schools. One of our newest and kind of revamped programs is called In-Depth. So one of the biggest things that we hear from schools and community youth-based organizations is that students are violating their policies for quitting smoke or for smoking on school property, and they really are looking for something to kind of handle this. And so one of the programs that we developed, it actually was formerly called Alternative to Suspension. And we've actually developed this program and called it In-Depth, which stands for Intervention for Nicotine Dependence, Education, Prevention, Tobacco, and Health. And so this is a mandatory program for students who get caught violating a tobacco policy on campus. It's delivered over 4 sessions. Each session is about 50 minutes. And the important part about it is it's not, although it's a mandatory program for students to attend who violate policy, it's actually builds support. It doesn't really focus on the punitive pieces because we found that doesn't necessarily work. NOT is actually the youth quit smoking program. So In-Depth is kind of a pre-cessation program. It's one thing we found when we piloted this program is 60% of the youth who participated wanted to quit. We knew that In-Depth was not our smoking cessation program for youth. So NOT is actually an evidence-based curriculum. It's delivered over 10 sessions, and it really focuses on positive behavior change as well as building support and recognizing the signs of addiction. Again, this has probably over 10 years of evidence-based work, and we're really excited to be more inclusive of e-cigarettes, which we know is what most youth are using at this moment. So as far as adults, again, talking about e-cigarettes and smoking, we know that we recommend the FDA-approved methods to quit smoking, the over-the-counter products like patches, gum, as well as medications like Zyban and Wellbutrin. But also a really important piece of that is to receive the support. And one of our signature programs is Freedom from Smoking, which is a evidence-based group cessation program, and actually Suburban Hospital offers this program So we're so excited to have them as one of our partners. But also we know that not everyone attends in-person support groups, but there's also over-the-phone counseling through our lung helpline, as well as self-help guides. And also we want to continue to encourage people to call the Quit line and seek resources through their physicians as well. So to learn more about e-cigarettes, one thing, as well as tobacco cessation, one thing that I work on planning is the One Force Expo, which is a full-day conference for healthcare professionals, patients, and caregivers to learn more about lung disease. And this is a really wonderful program this year for healthcare professionals as well as patients and caregivers. Our plenary, our main focus of this expo is on the vaping epidemic, because it is something that there's a lot of information out there, and this is just one of our opportunities to share all that information. And so for any parents out there or those working with youth, we do encourage you to talk to your kids and talk to your teens about e-cigarette use. And one of the awareness campaigns that actually launched, I want to say a little bit earlier this year, is called the Vape Talk. And this is, again, it's an awareness campaign. It has a parental download that really gives suggestions and talking points and ability to recognize signs that your youth may be using. And it really helps build that conversation so you can more appropriately talk to them about this. And then also, the American Lung Association, if you have not been to our website, we have information about almost every, if not every, lung disease. And we are really proud of our tobacco briefs and trends and just some of the resources that we provide annually and update frequently our tobacco briefs. And again, that's it.
Nicely done, Nicole. So I want to make two comments, and then we will turn it over to the audience for the Q&A. So the one thing that I found when I manage patients that are coming to see us exclusively, for instance, for electronic cigarette use, is they really try to make a distinction that it's not tobacco. And my challenge here, I know it's just being a stickler for the language, but I tell them, if I test you for tobacco-like products, you will be screened as positive, right? We know we can find what's called annabasine in your urine. Annabasine is an alkaloid only found in tobacco plants. So one of the ways I measure if patients are actually using tobacco-like products, because nicotine and cotinine can be screened positive because maybe you're using nicotine replacement therapies and so forth. So I tell them there are tobacco products in electronic cigarettes in addition to other chemicals. So don't be fooled. Again, that safety concern, electronic cigarette campaigns will do everything possible to make it clear that we are distinct from traditional combustible cigarettes, even though they do use a lot of the same chemicals in them, in addition to others. The quit smoking conversation is one of the most powerful things that electronic cigarettes have always used against us. When I've gone to Capitol Hill, whether it's in Annapolis or DC, the tobacco lobbyists love coming at us with a recent publication at the New England Journal of Medicine saying, look, they use electronic cigarettes, they can stop using combustible cigarettes. So I love that you discuss and emphasize going from combustible to electronic is not quitting smoking. And what I usually love to do to those same lobbyists is, did you read the editorial? Which those authors really negatively impacted that publication, because what they showed was that percentage of 20% quitting traditional cigarettes, you can get that same outcome by using FDA-approved medications, right? Bupropion with a nicotine replacement therapy patch can get you to 20% as well. Varenicline, which is Chantix, can get you up to 26%. So we have FDA products that have been really extensively studied that are safer. We know they are safer than electronic cigarettes. So if you want someone, you want your loved ones to quit smoking in a non-judgmental way, get them the resources that they need, help them out. What I always say is be pro-smoker, but anti-smoking, because that implies a non-judgmental conversation to have. So with that said, the only last question I'm going to pose to you, then turn it over. Can you tell us one more time where we can find all this great material?
Sure, lung.org.
Easy, perfect.
Yes.
I'm a lung doctor, so I wish I came up with that website first. So with that said, it is 1:43, which I'm looking at this outline right on time. So thank you, moderator person here. Let's turn it over to some Q&A from the audience. Yes, you have your hand raised, yes.
So I'm Dean of Students at a school near Holy Cross Hospital. From a pathophysiology standpoint, lots of vaping products have nicotine. So what are some of the things that nicotine causes that you can take to our students and say, hey, nicotine is bad for you? And then the second component is whether the particulate size of the vape allows those particles to get deeper to the bronchioles or the alveoli, and whether that contributes to some worse outcomes.
Do you mind if I fill that first?
I'm going to let you do
All
that.
right. So, great question. I think you, Dean. So, one of your first questions was nicotine in of itself, right? The harms of that. So, I already told you that it does a lot of rewiring in the brain, and you may say, well, how bad can that be? So, nicotine in the early 2000s, we when I say we collectively, I mean good humans, non-tobacco companies, right? We sued tobacco to put a cap on the amount of nicotine allowed to be put in a cigarette. So, if you buy a traditional cigarette, combustible, some of the cigarettes have less than 1% of nicotine in them. With that said, if you go to a vape website, I'm not encouraging that, I've done that just for my own research. Some of the vape products have up to 30% nicotine. So what we see is nicotine's effect on especially the youth who have never been exposed to it, who have never built up a tolerance to it, you develop nicotine-related sicknesses, right? Nausea, vomiting. You can get an acute lung injury just from a lot of nicotine as well being brought in. So there are a lot of dangers to systemic nicotine at high levels. Your question about does the particulate matter size help get to the most distal ends of the lungs? The answer is actually yes and no. Because combustible cigarettes, you can get to the distal end. What actually drives those products to get to the distal end is the smoking mechanics, right? So if you talk to a person who smokes combustible cigarettes, their smoking mechanics vary. They don't need to put that much effort to get the cigarette to be lit, to drag it in. A lot of them don't do deep inhalations. This has been well and extensively studied in order to understand smoking mechanics. But as one of our, I think it was Dr. Corkin who discussed the battery-operated heating coil devices in an electronic cigarette, that some of them demand the person who's smoking to take in long drags, long puffs, and deep inhalations in order to heat that coil properly, right? So that's how those particulate matter vapes get to the most distal end, is because of the smoking mechanics that the patient has to employ. And if you see on social media some of the behaviors around vaping, right? I think Dr. Roderick, you were discussing this, a lot of the youth bring it really deeply in and then exhale it out slowly. That's usually what drives them to the most distal, fragile ends that if Dr. Corkin's daughter is in here, I already told her the cells to bring up. But that's usually what drives them there.
That's great, thank you.
Any other, come on, questions? Oh, I'm going to start calling the people that are staring at the stage. Yes.
Can you elaborate on the secondhand effects of vaping and smoking?
Right, and Dr. Corkin put me on this, so and by all means, please weigh in. So what I would say is that's still unknown, incredibly unknown. Right, what Dr. Roderick mentioned earlier about first-hand cancer coming from smoking, right? The U.S. Surgeon General Terry's 1964 commentary really was first-hand users, but we didn't know about second-hand users for quite some time. So that's a huge challenge for us now, right? Because everyone's exposed to secondhand smoke. A lot of people are exposed to secondhand smoke from electronic cigarettes. The case that we submitted to the British Medical Journal is a patient of mine who her husband vaped consistently in the bedroom for 2 years. And she was diagnosed with hypersensitivity pneumonitis, a really bad type of organized pneumonia that Dr. Broderick was showing us on slides. And how bad was it? We were discussing transplant for her, right? That's how severe this case was. How many other cases are out there? We don't know, right? Because one of the challenges we have as physicians is that we're not asking our patients, are you exposed to secondhand smoke from electronic cigarettes? It's not been ingrained in our heads to begin to ask that. So the denominator out there is probably much bigger. Do you guys have any comments to add to this?
No, but I would comment on, just because we mentioned lung transplant twice, that there was one patient in New York, I believe,
Yes.
who underwent a bilateral or a double lung transplant for a vaping-associated lung injury, and Dr. G just said they were considering it for a patient of his. that's not the solution. Their lungs are precious, and we don't have enough lungs, right? So there are plenty of individuals out there with other smoking-related diseases, COPD, emphysema, who are on the transplant list and are waiting for lungs for years at a time and never get them. Other inherent lung diseases who are waiting for lungs and never get them. And cystic fibrosis patients, for example, who need transplant to live. So lung transplant for vaping-associated acute lung injury is not a solution. It's not an answer. We, on one occasion now that we know of, have employed that to save the life of a 17-year-old boy, young man. But please don't think that lung transplant is going to fix that, or that it would be available for everyone who gets to an end-stage lung disease for any sort of vaping-associated illness, because we just don't have enough lungs to offer that from a lung transplant surgeon. It's not going to happen.
And the point exceedingly well taken. I just wanted to make sure everyone knows that demographically in this country, the three leading states where the highest incidence of this EVALI have occurred are Illinois, Texas, and California. Coming in at a close second are Colorado, Minnesota, and the state of New York, which is where this double lung transplant occurred last week. But then following on for others would be Florida, Tennessee, North and South Carolina, Pennsylvania, New Jersey, Ohio, Indiana, and Massachusetts. A couple of the smallest states. We now are good in the sense that we have a relatively, for the size of the state, a relatively low percentage of this incidence of EVALI. But again, we as physicians who are treating patients, critically ill patients, we're not attuned to this as of yet, but we're becoming attuned to it relatively rapidly because of the incidence of it.
And then going back to your question about the secondhand smoke exposure, everything you're hearing is firsthand exposure. Our fear is that the secondhand exposure will also have dire consequences depending on the patients and so forth. So this is a problem that impacts everyone. So even if you're not a natural firsthand user, secondhand users who may not even know they're being exposed to it, right? Because this doesn't smell like traditional cigarettes where people can walk away from, we're putting them at risk as well. So great question, really good question. Yes, ma'am.
My name is Junie Murray from John Boston, Missouri. My question is, specializing with pulmonary and thoracic care, how do you stop your patient from using this product while having any diseases related caused from smoking or vaping and having an addiction?
So the question was, how do you stop your patient from using these products? Is that correct?
Yes, having an addiction.
Who have a nicotine-related addiction. Do you gentlemen, or Nicole, would you like to go first?
Yeah, I'm good. So again, I think really the first step is kind of to assess that, and I'd love to hear different opinion, is really to assess the level of addiction, depending on the number of cigarettes smoked, the time of day, and really kind of get the perspective of when somebody smokes, the type of cigarette that is smoked or e-cigarette, if possible, and then kind of develop a quit plan with available resources.
Yeah, and so what Nicole laid out is actually, so I treat tobacco addiction and tobacco dependence and so forth. What Nicole laid out actually is trying what's called creating a smoking phenotype. And I do that every day with patients who come in smoking traditional cigarettes, right? They tell me their brand, USA Slims, Mavericks, Newports, right? And what I do is I go to government websites and I can tell them the amount of tar and the amount of nicotine in those cigarettes, right? Then I learn their smoking mechanics, and I learn what's called overall the smoking topography, when they smoke, why they smoke, and so forth. And to some extent, with that insight, I can create a smoking phenotype and understand the gravity of the nicotine addiction. And then we create individualized plans to help them through that in a timeline. The challenge with electronic cigarettes is because they're not regulated, I have no idea how to create a nicotine addiction severity for patients, right? So they can tell me how many puffs they do in a day, how many pods or cartridges they go through. I don't know what that means, right? These products aren't very forthcoming with telling me how much nicotine is in these products. At the most, I have to do some simple algebra, which for a doctor of my age, I haven't done algebra that frequently. So yeah, I have to resort back to my high school years. So that's the challenges for electronic cigarettes. I can't create that same kind of elegant scientific understanding of someone's nicotine addiction severity. So I extrapolate a lot. And that's what we do in order to help these patients through. Of my 25 youth who are trying to quit electronic cigarettes, about half of them have been successful and the other half have continued to struggle, right? And so that's the dilemma that we're faced with. This isn't apples to apples. This is the Wild West of the nicotine addiction to some extent. So it is very challenging, and that's why I would reaffirm the best thing that we can do is create a strict regulation so we know what is going in these products and the amount that's going in as well.
We're fortunate, I think, fortunate and unfortunate, but Dr. Corcoran and I see a lot of patients who are newly diagnosed with lung cancer and are preparing for surgery. About 70 to 80% of whom are former smokers, and about 10 or 15% who are still smoking at the time that we evaluate them. And for us, that often is what we call a teachable moment. For someone who's been smoking for 40 or 50 years, well, this is it. Now I actually have lung cancer. I have a bona fide diagnosis of that smoking-related injury or smoking-related illness. And for many, that's enough, particularly when we meet with them and we say that we are about to embark on a plan to do a major lung operation, for example, to take that tumor out. And we also inform them about the risks to their overall outcome at the time of surgery from smoking, and oftentimes that's enough. And for patients who are not yet willing to quit or who are not able, at that point we engage a lot of the other resources that you've heard about, where we have smoking cessation specialists at our hospital who will meet with them, or go see the medical specialists who specialize in addiction medicine.
It's interesting, for patients of ours, the highest incidence of developing a lung cancer is, in general terms, someone who's had a previous lung cancer. So those, in general terms, are folks who have smoked, and we've developed, nationally have developed lung cancer screening programs in which individuals have a high incidence or a long-standing history of smoking cigarettes would enroll in and get imaging in the form of either CAT scans, you've seen, or chest x-rays and such. And just the people that need our help are the ones that don't want the help, the ones that, inveterate smokers, particularly inhaled combusted burning tobacco products. Many of my patients tell me, Doc, I don't want to know. I don't want to know what I don't want to know. That's why I don't want to get a CAT scan. So it's the folks that need our help the most are sometimes the ones that are the most resistant to our offering this type of help.
Yes, sir.
So with more and more states legalizing marijuana right outside of DC, I'm just wondering, we've talked a lot about nicotine. You guys have done a great job of educating us on that. I'm just wondering if you see any crossover with the marijuana e-cigarettes and the effect that that's having.
So, great question. And again, for those who couldn't hear, so you're asking about the marijuana electronic cigarette devices, and we're seeing some crossover to some extent.
And I think our kids are educated a lot on the nicotine aspect of it. I'm just wondering if there's any crossover with that. If it's right as legal.
Yeah, so for the first thing I say is, unless it's just air, your lungs are not designed for combustible cigarette smoke or electronic cigarette smoke. So it will have ramifications on your lungs, and that spectrum always will depend on the patient and so forth. The marijuana electronic cigarettes are some of the ones that Dr. Corcoran mentioned earlier about certain chemicals that have led to the vaping-induced lung injuries from vitamin E and so forth. And that's actually one of my favorite conversations, because when again, for those of us who are ever being testifying against tobacco lobbyists, they always love to throw at us these chemicals in electronic cigarettes are on the FDA's generalized as recognized safe list, like the GRAS list, the GRAS list. My comment to that is those have all been proven safe through ingestibles, right, eating. They've never been proven safe as inhalants. So the crossover, yes, it's not as abundant as the electronic cigarettes with nicotine, but does carry as well dire consequences. Dr. Corbin?
Dr. G is absolutely 100% spot on. When we look at the incidence of the development of the individuals who have been studied who have this E-Valley, this e-cigarette and vaping-associated acute lung injury, actually the ones that were using nicotine, about 62% were nicotine users, but 84% were THC users, the marijuana users for the vaping. And the ones that only 11% were pure nicotine-only users, so there's a huge amount of crossover. So therefore, if I'm going to use these e-products, I'm going to be interested in both the nicotine as well as the THC elements of it. No, it's a great question, and the answer is there clearly is some degree of crossover.
Excellent. And I'm looking at the time. It is 1:59, and as your fantastic moderator, because I've been staying on time, it's not one of the things I do very well, and you've got doctors to try to stay on time. So on behalf of Johns Hopkins Medicine Suburban Hospital and Sidney Kimmel Cancer Center, we would like to thank our partners, the American Lung Association, Montgomery County Cancer Crusade, and Stone Ridge School of the Sacred Heart. A special thanks for helping us organize and host this event. Thank you all.
Thanks a lot.